be educated.
Hello. Welcome to another episode of Caring Heart, a nurse journey of learning, empowerment, and growth. I'm Bernice Ododo. It is always a pleasure to have you watch my channel. Now to today's topics: 5 challenges encountered by nurses in providing quality care. Nurses continue to encounter burnout in the course of the job because of the emphasis on quality care by organizations and regulatory bodies. While patient satisfaction continues to be a top indicator for quality care, those who provide the care continue to encounter challenges which limit them from providing the quality care expected. Nurses constitute 30% of hospital employment according to CDC. When nurses are unable to deliver quality care, the organization will collapse. Here are 5 challenges that nurses continue to encounter today. Number 1 challenge is the high patient workload. We all know that managing a high number of patients can lead to burnout. The time in juggling from one patient to the other is reduced, making it difficult to provide personalized care, which gives patients satisfaction. Sometimes 3 patients of the same nurse call light might go off at the same time, while the nurse is either in the middle of a procedure or administering medication. Second challenge is limited resources. Nurses constantly encounter constraints such as staffing shortages and insufficient equipment because of budget limitations, which can ultimately impact the quality of care. Maybe a unit of 30 to 40 patients might be staffed with 5 registered nurses with limited nurses' aid. Sometimes nurses have to improvise some equipment to perform some procedures. Another challenge is complex patients' needs. Dealing with patients who have multiple and complex health conditions is very challenging. Such patients may require advanced skills and coordination. In some healthcare organizations, medical surgical units have mental health patients, which create a chaotic environment unsafe for other patients in the unit and places burden on the nurses. Nurses have to struggle on how to provide mental health care for such patients. Number 4 challenge is communication barriers. Language differences, cognitive impairment, or emotional distress can hinder effective communication between nurses and patients. This might ultimately lead to misunderstanding. Yes, your organization may be robust to provide some form of interpreter resource. You will definitely agree with me that utilizing those resources often consumes time. The time to contact them, getting the patient ready, and making self available can be overwhelming. Number 5 challenge is that of regulatory and documentation requirements. Complying with extensive regulatory requirements coupled with accurate documentation can be time consuming. For example, getting a 500-pound patient out of bed to chair or turning the patient every 2 hours can take the valuable nurse's time. These challenges continue to drive some nurses away from the bedside. Confronting these challenges requires a combination of skills, resilience, and commitment. What other challenges do you encounter? Leave your comments. Thank you for watching. There is a contact link somewhere in the description box. And if you want to contact me and wish to learn more about finding a good fit organization, crafting an effective resume, and interview prep, click the link in the description below. Like and share so we can grow a better community where nurses can learn, be empowered, and grow. But remember, a caring heart makes a difference. Thank you and see you in the next video. Bye.
I wish I knew